Ambulatory care and home care systems, a comprehensive healthcare delivery framework. Introduction to ambulatory and home care systems. The modern healthcare landscape has undergone a fundamental transformation over the past several decades, with ambulatory care and home care services emerging as cornerstone components of comprehensive healthcare delivery. These care modalities represent a paradigm shift from traditional hospital-centric models toward more accessible, cost-effective, and patient-centered approaches to healthcare. Understanding the structure, operations, and evolving role of these systems is essential for healthcare professionals, particularly pharmacists, who increasingly serve as integral members of interdisciplinary care teams across diverse practice settings. Ambulatory care, defined as healthcare services delivered on an outpatient basis without requiring overnight hospitalization, has experienced unprecedented growth driven by technological advances, changing patient preferences, and economic pressures to reduce healthcare costs. This expansion reflects broader trends toward value-based care, population health management, and the recognition that many medical conditions can be effectively managed outside traditional inpatient settings while maintaining or improving patient outcomes and satisfaction. Defining and understanding ambulatory care. Ambulatory care encompasses a vast spectrum of healthcare services that can be provided to patients who are able to walk in and out of healthcare facilities on the same day. This care delivery model has gained prominence due to its ability to provide high-quality medical services while reducing the financial burden on both healthcare systems and patients. The scope of ambulatory care has expanded significantly, encompassing routine preventive care, chronic disease management, minor surgical procedures, diagnostic services, and complex therapeutic interventions that previously required hospitalization. The rapid expansion of ambulatory care has been particularly influenced by the growth of managed care organizations which have strong financial incentives to provide care in the most cost-effective settings possible. Managed care's emphasis on controlling costs while maintaining quality has led to the development of sophisticated ambulatory care networks that can handle increasingly complex medical conditions in outpatient settings. The Medicare prospective payment system has served as a significant catalyst for ambulatory care growth by creating financial incentives for hospitals to minimize length of stay and transition patients to outpatient care as quickly as medically appropriate. This system has fundamentally altered hospital discharge planning processes and accelerated the development of ambulatory care infrastructure to support patients with continuing care needs following hospital discharge. The Patient Protection and Affordable Care Act further accelerated ambulatory care expansion by mandating that health insurance policies cover 10 essential health benefits, including ambulatory patient services, emergency services, and behavioral health services. This coverage expansion has improved access to ambulatory care services for millions of Americans while creating new opportunities for healthcare providers to develop innovative care delivery models in outpatient settings. Types of medical practices in ambulatory care. The organization of ambulatory care services reflects a diversity of practice models, each with distinct advantages and challenges for both providers and patients. Solo practice, historically the predominant model of physician practice, offers practitioners maximum autonomy and the ability to maintain direct relationships with patients while avoiding the complexities of organizational governance and shared decision-making inherent in larger practice arrangements. However, the number of solo practitioners has declined dramatically due to managed care pressures, increasing administrative burdens, and the financial challenges of maintaining independent practices in an increasingly complex healthcare environment. Solo practitioners often struggle with the costs of implementing electronic health records, meeting quality reporting requirements, and negotiating favorable contracts with multiple insurance plans, leading many to join larger practice organizations or health systems. Group practice arrangements have emerged as the dominant model for ambulatory care delivery, offering numerous advantages including shared operational costs, centralized administrative functions, and access to professional business management expertise. These practices benefit from economies of scale in areas such as information technology, billing and collections, and compliance with regulatory requirements, while also providing opportunities for professional collaboration and coverage arrangements that improve work-life balance for participating physicians. The trade-offs associated with group practice include reduced individual autonomy, shared financial risk, and the need to conform to group policies and procedures that may not align with individual preferences. However, The benefits of group practice have generally outweighed these limitations, leading to continued consolidation in the ambulatory care marketplace and the development of increasingly sophisticated multi-specialty group practices that can provide comprehensive care coordination. Primary care providers and healthcare teams. Primary care providers serve as the foundation of effective ambulatory care systems, providing comprehensive, coordinated, and continuous care that addresses the majority of patients' healthcare needs. The primary care workforce includes physicians trained in family medicine, internal medicine, and pediatrics, as well as advanced practice providers such as nurse practitioners, physician assistants, and certified nurse midwives who can provide many of the same services as physicians. The scope of practice for nurse practitioners and physician assistants has expanded significantly, with research demonstrating that these providers can safely and effectively deliver more than 3/4 of the services traditionally provided by physicians. This expansion has been particularly important in addressing primary care workforce shortages and improving access to care in underserved communities. The patient-centered medical home model has emerged as a leading framework for organizing primary care delivery, emphasizing team-based care coordination, comprehensive care management, and enhanced patient engagement. The patient-centered medical home model represents a systematic approach to primary care that integrates care coordination, quality improvement, and patient satisfaction initiatives while maintaining focus on the physician-patient relationship as the cornerstone of effective care. The Affordable Care Act includes numerous provisions supporting patient-centered medical home implementation, including expanded Medicaid eligibility that increases access to primary care for low-income populations, enhanced payment rates for primary care and preventive services, and support for innovative care delivery models that emphasize care coordination and population health management. These policy changes have accelerated patient-centered medical home adoption and created new opportunities for primary care practices to develop sustainable business models around comprehensive care coordination, urgent care centers, and accessible care models. Urgent care centers have emerged as an important component of the ambulatory care continuum, providing convenient access to medical care for conditions that require prompt attention but do not rise to the level of emergency department visits. These facilities typically operate extended hours, including evenings and weekends, and offer walk-in services without requiring appointments, making them particularly attractive to patients with busy schedules or limited access to primary care. The services provided by urgent care centers encompass a broad range of acute medical conditions including respiratory infections, minor injuries, skin conditions, and routine healthcare needs such as physical examinations and preventive care services. This scope of practice positions urgent care centers as an important bridge between primary care and emergency department services, potentially reducing inappropriate emergency department utilization while improving access to timely care. Urgent care centers offer several advantages over traditional emergency departments, including significantly lower costs, shorter wait times, and more convenient locations. These centers are typically staffed by physicians, nurse practitioners, and physician assistants who are trained to manage the types of conditions commonly seen in urgent care settings, while maintaining appropriate protocols for referring more serious conditions to emergency departments or other appropriate care settings. The growth of urgent care centers reflects broader consumer preferences for convenient, accessible healthcare services that can be obtained without the delays and complexities often associated with traditional primary care scheduling. This trend has been further accelerated by high-deductible health plans that make consumers more price-sensitive and interested in lower-cost alternatives to emergency department care for non-emergency conditions. Ambulatory pharmacy services across settings. Pharmacy services in ambulatory care settings have evolved significantly beyond traditional dispensing functions to encompass comprehensive medication therapy management, clinical consultation, and direct patient care services. In hospital outpatient clinics, pharmacists work closely with medical teams to optimize medication regimens, provide patient education, and ensure safe transitions of care between inpatient and outpatient settings. The integration of pharmacists into hospital outpatient clinics has required careful consideration of workflow design, space allocation, and privacy requirements to ensure that pharmaceutical care services can be delivered effectively while maintaining patient confidentiality. These considerations have led to innovative clinic designs that incorporate dedicated consultation areas for pharmacist-patient interactions and integrated documentation systems that support collaborative care models. In primary care and family practice settings, pharmacists have demonstrated significant value in improving patient outcomes through direct involvement in medication management, chronic disease care, and preventive health services. Research has consistently shown that pharmacist interventions in primary care settings improve medication adherence, reduce adverse drug events, enhance physician efficiency, and contribute to better clinical outcomes across a wide range of conditions. Pharmacists in primary care settings typically provide services including comprehensive medication reviews, physical assessments, laboratory test ordering, and medication regimen adjustments in collaboration with physicians and other providers. These expanded roles require additional training and credentialing, but have been associated with improved patient satisfaction, reduced healthcare costs, and better management of chronic conditions such as diabetes, hypertension, and dyslipidemia. Community pharmacy services continue to evolve beyond traditional prescription dispensing to include clinical services such as immunizations, health screenings, medication therapy management, and chronic disease management programs. Independent pharmacies, chain pharmacies, and mail-order pharmacy services each offer unique advantages and serve different patient populations with varying needs and preferences. Retail clinics, also known as convenient care clinics or minute clinics, represent an innovative approach to basic healthcare delivery that leverages the accessibility and convenience of retail locations. These clinics are typically located in grocery stores, pharmacies, and retail chains, offering relatively inexpensive healthcare services for common conditions and routine healthcare needs. The services provided by retail clinics focus on high-volume, low-complexity conditions such as common colds, ear infections, strep throat, and routine health maintenance activities including physical examinations and immunizations. These clinics are usually staffed by nurse practitioners who can diagnose common conditions, prescribe medications, and provide basic health education while maintaining appropriate referral relationships with other healthcare providers for more complex conditions. Home care industry overview and components. The home care industry represents a rapidly growing segment of healthcare delivery that encompasses multiple distinct service categories, each addressing different aspects of patient care in residential settings. Home health services coordinate comprehensive care delivery through skilled nursing, rehabilitation therapies, social services, and other professional healthcare services provided directly in patients' homes, offering a cost-effective alternative to institutional care while supporting patient preferences for aging in place. Home health providers serve as care coordinators, working with physicians, patients, family members, and other healthcare professionals to develop and implement comprehensive care plans that address medical, functional, and psychosocial needs. The interdisciplinary approach characteristic of home health services enables patients to receive coordinated care while maintaining independence and remaining in familiar environments that support recovery and quality of life. Home infusion therapy has emerged as a sophisticated component of home care that enables patients to receive complex parenteral and enteral therapies in their homes rather than requiring extended hospitalization. This service includes administration of antibiotics, chemotherapy, parenteral nutrition, pain management medications, and other specialized therapies that were previously available only in institutional settings. The advantages of home infusion therapy include significant cost savings compared to hospitalization, improved patient comfort and quality of life, reduced risk of healthcare-associated infections, and the ability for patients to maintain normal daily routines while receiving treatment. However, successful home infusion programs require careful patient selection, comprehensive caregiver training, and robust support systems to ensure safe and effective therapy administration. Home medical equipment services provide essential durable medical equipment, respiratory therapy supplies, and other medical devices that enable patients to manage their health conditions effectively in home settings. This industry segment includes wheelchairs, hospital beds, oxygen delivery systems, ventilators, and other equipment that facilitates patient mobility, respiratory function, and overall functional independence. Role and responsibilities of home care pharmacists. Home care pharmacists play multifaceted roles that extend far beyond traditional pharmaceutical expertise to encompass patient assessment, care plan development, therapy selection, and ongoing monitoring of treatment outcomes. These professionals may work through community pharmacies, specialized home care companies, or hospital outpatient departments, requiring them to develop competencies in patient selection, insurance authorization, care coordination, and clinical monitoring. The selection of appropriate candidates for home care pharmacy services requires careful assessment of multiple factors, including clinical stability, adequacy of support systems, financial resources, and access to communication technologies. Patients must demonstrate sufficient clinical stability to safely receive care outside institutional settings, while having adequate family or caregiver support to assist with complex medication administration and monitoring requirements. Home care pharmacists must also navigate complex insurance and reimbursement systems to ensure that patients can access needed therapies while maintaining cost-effectiveness for payers. This requires expertise in prior authorization processes, coverage determination criteria, and alternative therapy options that may be more readily covered by different insurance plans. The clinical responsibilities of home care pharmacists include developing individualized care plans, selecting appropriate therapeutic regimens, addressing compounding and preparation requirements, and providing ongoing monitoring and adjustment of therapy based on patient response and changing clinical conditions. These responsibilities require close collaboration with physicians, nurses, and other members of the healthcare team to ensure optimal patient outcomes. Factors influencing home care industry development. Reimbursement issues represent perhaps the most significant challenge facing the home care industry, with third-party payers wielding substantial influence over service availability and delivery models through their coverage policies and payment mechanisms. Government agencies, managed care organizations, and private insurance companies each maintain distinct coverage criteria, billing requirements, and reimbursement rates that create administrative complexity and financial uncertainty for home care providers. The inconsistency in payer policies creates significant operational challenges for home care providers, who must navigate multiple different billing systems, prior authorization requirements, and coverage limitations while attempting to provide consistent, high-quality care to patients with diverse insurance coverage. This fragmentation makes it difficult for providers to achieve operational efficiency and can result in delays in care initiation or limitations in service availability. Legal, regulatory, and professional standards significantly influence home care operations through requirements such as the Health Insurance Portability and Accountability Act, which establishes comprehensive privacy and security requirements for protected health information. Health Insurance Portability and Accountability Act. Compliance requires home care providers to implement sophisticated information management systems and staff training programs to ensure patient confidentiality while enabling necessary care coordination activities. The Health Insurance Portability and Accountability Act also includes provisions for insurance reform and administrative simplification that have benefited home care providers through standardized electronic claim submission requirements and improved payment cycle efficiency. These provisions have reduced administrative burden and improved cash flow for many home care organizations while ensuring better protection of patient privacy rights. Technological advances have revolutionized home care delivery through innovations in infusion pump technology, wireless communication systems, and electronic health information systems. Modern infusion pumps provide enhanced safety features, dosing accuracy, and monitoring capabilities that enable complex therapies to be administered safely in home settings, while internet and wireless technologies facilitate real-time communication between patients, caregivers, and healthcare providers. Future directions and implications. The future of ambulatory and home care systems will be shaped by continued demographic changes, technological innovation, and evolving healthcare policy priorities that emphasize value-based care, population health management, and patient-centered service delivery. As healthcare systems continue to focus on reducing costs while improving outcomes, ambulatory and home care services will play increasingly important roles in providing accessible, effective, and efficient healthcare delivery. The role of pharmacists in these settings will continue to expand as healthcare teams recognize the value of pharmaceutical expertise in optimizing medication therapy, managing chronic diseases, and supporting care transitions. Success in these evolving care models will require continued innovation in service delivery, ongoing professional development for healthcare providers, and sustained collaboration across disciplines to ensure that patients receive coordinated, high-quality care regardless of the setting in which services are provided.